My research was all about improving outcomes in back pain. And if you look at the history of back pain, historically people have been told to take bed rest. But that is the worst advice you can give someone with back pain. And when I was pregnant, I realized that I was on the other side. Now I was a consumer of healthcare, not a provider anymore. And I had all these questions. I'm really grateful to her for giving me that opportunity at that time and for taking me seriously. On the other side, after I gave birth, I realized that I was completely unprepared for breastfeeding. And I never had these questions before the baby came. Because when you come from a background of having understood these problems, when you're talking in a scientific language, you do tend to get taken more seriously. That was the first time where I realized that this profession exists and the value that it brings to women. So guys, this is not just a podcast. This is a conversation we should have had years ago. If you're feeling unheard and if you feel like you have questions that are coming up, then this is the place for you to start. I'm Dr. Sonali Santhanam, founder of Birth Basics, and we're here with what women need. We're just getting started. Welcome. So women make up 50% of the population, and we take care of the other 50 as well. But this often comes at a cost, doesn't it? It's usually our own health. And I find it's mostly because we put ourselves last. My mom-in-law told me this, and I'm still trying to follow her advice. She said, take care of yourself first. Put on your oxygen mask so that you can take care of the people around you. And that's what we are here for. We are here today to have conversations that will help you get the right information at the right time about your health. It will help you feel strong and confident in your body at every stage of life. And this episode is very raw, it's very personal. It's about my journey through forming Birth Basics. It's about how I went from being a healthcare researcher and a physical therapist to being a confused mom, and finally setting up this space that is a platform for women's health. So let me start by giving you a little background. I'm a healthcare researcher. I have a doctorate in rehabilitation science and with a focus on physiotherapy. My research was all about helping improve quality of care, and that included ensuring that people get the right kind of care at the right time from the right provider. My research was all about improving outcomes in back pain. And if you look at the history of back pain, historically people have been told to take bed rest, right? Immediately, as soon as your back gets hurt, the first thing you're told is lie down in bed rest 3 weeks. But that is the worst advice you can give someone with back pain. We all know that that's outdated advice. What does current research tell us? It tells us that early movement is very important. The focus is more on strengthening the body and relaxing the muscles that have gone into protective spasm, and the use of passive modalities like trigger point release only when necessary, right? So what happens when you create this fear of movement in someone who has back pain? It's only going to make things worse, and that is doing more harm than good. So if you apply this to women's health, look at the outdated advice we're giving women. Just do Kegels. Have a glass of wine and you'll be fine. It's normal to leak when you're that age, right? I mean, it doesn't even sound right. So my research has always been about bridging the gap between what we know and what we should be doing. And when applied to women's health, it's so important to find that right care. So that is how I started. But how did I get into childbirth education from physical therapy? Well, when I first moved to Chennai, and I'm not from Chennai, I'm originally from Bombay, I found it hard because I didn't know the language. And when you're in the healthcare industry, it's very important to speak the local language. So I decided to take a break, and I said, in the meanwhile, we could start a family. And when I was pregnant, I realized that I was on the other side. Now I was a consumer of healthcare, not a provider anymore, and I had all these questions. And honestly, I wasn't prepared for it. I asked my OBGYN, I asked my doctor so many questions that initially she was, entertaining me with responses like, don't worry, just go for a walk, nothing's gonna happen. And then finally, she said, well, you've researched so much about this and you're a physical therapist, so why don't you start teaching childbirth education at my clinic? And I jumped at that opportunity. I mean, it was the best way for me to stay connected with my baby, to stay connected with my body. And, I'm really grateful to her for giving me that opportunity at that time and for taking me seriously. And I would consider myself lucky in some ways to have a doctor who didn't dismiss my questions, but then I also realized that it wasn't just my luck, but it was also the kind of questions I was asking. They were probably well-researched and, if I should say so myself, more intelligent, because when you come from a background of having understood these problems, when you're talking in a scientific language, you do tend to get taken more seriously. I mean, no care provider wants to be asked, I read this on Google, what do you think? So there lies the conversation between the patient and the care provider. And that's what we were trying to do by bridging the gap through childbirth education. So I did realize this though, when I spoke to family and friends, that most women get very generic advice like, don't worry, that's normal, or you'll know when you get there. But this generation, we want a lot more. We want control. We want to know what's happening with our bodies. And that's why I started childbirth education, initially with my care provider, who was really nice to give me this opportunity. And then from there on, I took it up. So I had a really brilliant birth experience. It was absolutely fabulous. It was very empowered. And I felt that I had full freedom of movement in the birthing room because I had asked for that kind of care. But what I was not prepared for was the postpartum because, and I always say this, real labor begins after the baby is born, right? So what I wasn't prepared for was how challenging breastfeeding was going to be for me. So while I was over here, empowering women and couples, helping them understand what the birth process was like, on the other side, after I gave birth, I realized that I was completely unprepared for breastfeeding. And I never had these questions before the baby came. Well, to cut the long story short, I had pain for almost 8 months in my breastfeeding journey. And while I looked for what I found out for the first time was there existed a profession called lactation consultation. When I went looking for a lactation consultant, there was literally one consultant in the entire city of Chennai. And this is back in 2011, right? So tracking down her number was like looking for a treasure map. It was so difficult. And by the time I got a hold of her, I had actually already solved or resolved a lot of the issues I already had. But I was very grateful to speak to someone who actually understood my pain and gave me scientific advice. Again, lactation or breastfeeding falls into this gray area where, is it medical? Is it support that you get from friends and family? Is it a nurse who's supposed to support you? So that was the first time where I realized that this profession exists and the value that it brings to women. Just from a scientific perspective, understanding what's happening with your body, understanding how to regain the instinct that you might have as a mother, which unfortunately we are maybe losing because we're depending too heavily on information from the outside and not waiting for us to connect with our bodies and babies instinctively. And that's what really helped me then understand that I wanted to do even more for this community of women, and that's where I found my tribe. I decided to go back to school to become a lactation consultant, also partly because a couple years later, I was expecting my second child. And while we were really, really happy and excited, new baby coming into the family, I also realized that it brought a lot of anxiety. Anxiety because I literally had PTSD from all the incredibly challenging times I had breastfeeding my first child and troubleshooting. So I went back to school. I'm so glad I did, because honestly, it was 4 years later for me, and that's when I actually got closure. I understood for the first time why I had so many challenges and what the reasons for those were. For example, one of the reasons I had difficulty with breastfeeding was because I had taken an epidural. And when you take epidurals, they come with an IV overload, which means you're given a lot of IV drips, and that causes a lot of fluid retention in the body. And as a result of which, you could have pathological engorgement, which means the breasts are heavy with milk, but there's nothing coming out. So confusing for a new mother, where I thought, here I have heavy breasts, probably a lot of milk, but nothing seems to be going to the baby. You know, the thing that I find that I wish things had gone differently for me at that time, because I lost precious time with my baby. Instead of enjoying the first few weeks with my newborn, appreciating every little expression of hers, I was worried about the pain, and I was worried about my milk supply. So it really is very rewarding for me to be a lactation consultant. I enjoy working with families, knowing that they will never know the pain that I went through. And hopefully they'll be able to appreciate their babies and enjoy spending time with them without really having to worry about some of these things. So that is why I became a lactation consultant. And then you might ask, what is this journey? Childbirth education, or let's go back to healthcare researcher, childbirth education, then I became a lactation consultant, and then pelvic health. For me, that's coming a full circle. I always, at heart, I'm a physical therapist. Over the years, with my communication with women, my close contact with women and families, I've always had women come back and tell me, I am feeling so disconnected with my core. I don't know where my pelvic floor is. I don't understand how to get back to working out. And that's when I went back to looking at pelvic health as something that we could introduce here within Birth Basics to help and support the community even better, because that's where my true expertise lies. In 2022, I went back to America to certify as a pelvic health therapist. It's a very, very new field, so we have very few, and back then we had even fewer organizations or institutions that were offering the certification. So I had to fly all the way across the world. And would I have gone sooner? I definitely would. This was something that had been on my mind since 2017 actually, but there were babies, and then the pandemic happened. So I eventually went in 2022. And it was very, very well timed, because we were just coming out of the pandemic, and I decided that I needed a personal space. I was done with going from one hospital to the other. I was done with spreading myself too thin. I realized very quickly that there was no way for me to be in 5 places at the same time, acting out 3 different professions. And it was showing. It was really showing in the care I was giving people. I realized that I was becoming a bit cranky. I was trying to pour from an empty cup, if that makes sense. I also realized that I was becoming a little abrupt with the very people I was trying to help. And that is another aspect of healthcare that I really want to address through this podcast: compassion fatigue and burnout. So for a long time, I didn't realize that I was headed in the direction of burnout. I was working nonstop. I was working weekends. I was working evenings. I was working mornings. And I had people tell me, how do you do so many things? And I started telling myself, I don't. I'm actually not doing so many things. I felt like I wasn't able to perform or able to give my best as a parent. I wasn't able to give myself, to my family, to my partner, and even to my patients. And that's why I feel very, very strongly about this. I feel like we need better systems. We need more collaborations within the healthcare community to support each other. We need to form a support structure that offsets or shares responsibility rather than trying to do everything all at once. And the best way to do that is to have these conversations, to make sure that we are including healthcare providers also in this entire ecosystem of support. So this podcast is really about the full picture of women's health. It's not just about puberty, postpartum, menopause, it's about everything in between. We're talking about puberty, but what about everything that comes with it? The hormones, the emotions, the pimples. We're talking about planning a pregnancy, but what about getting your body really strong and making sure your partner is also ready for conception? We're talking about pregnancy. We talk about birth, but what about recovery in the postpartum and getting back to feeling good in your body? We talk about menopause, but what about all the years leading up to it? And can we do something one step ahead as preventive care? So guys, this is not just a podcast. This is a conversation we should have had years ago. If you're feeling unheard and if you feel like you have questions that are coming up, but nobody is hearing you and you feel unheard, then this is the place for you to start. I'm Dr. Sonali Santhanam, founder of Birth Basics, and we're here with what women need. We're just getting started. Welcome.